Moving on this week for chapter 16, we're covering, sorry my chair won't move, I want to come forward, covering gastrointestinal drugs. We've covered the urinary system, now we're going to move on to GI system. Antacids. One of the most common complaints for patients is heartburn, which is also termed pyrosis, and dyspepsia, which is acid indigestion. It's experienced by up to 40% of the population in the United States at least once a month. Antacids neutralize gastric acid and are widely available over the counter, which is why they are so commonly used. Other anti-ulcer agents will be discussed in a moment. Antacids may contain aluminum, calcium carbonate, or magnesium, usually either individually or in combination. Most of them also contain sodium. Calcium carbonate is commonly known as Tums, and it's rapid acting and possesses good neutralizing capacity, but may cause constipation and kidney stones if overused. Aluminum can cause constipation, whereas magnesium can cause diarrhea, so usually those are used in combination to balance those two effects out. The choice of a specific antacid preparation depends on how good it tastes, how much it costs, what are the adverse effects, how well it works, as well as the sodium content and the patient's renal and cardiovascular function. If you are choosing this antacid yourself for the patient, if the patient walks in, they're not going to know about most of the stuff, they're just going to pick up Tums because that's what they're familiar with. Generally, antacids have a short duration of action and are used multiple times a day. Side effects may include constipation with aluminum or calcium carbonate, diarrhea with those that contain magnesium, electrolyte imbalance, urinary calculi, and renal complications, osteoporosis, as well as burping and farting. Good times with heartburn. Precautions: anybody that has heart failure, chronic kidney disease, or history of renal stones, cirrhosis, dehydration, or electrolyte imbalance. Sometimes antacids can interfere with other medications, so commonly we make sure to advise patients to take them well before or well after their medications, but they should always talk with the pharmacist regarding this, if possible, or their doctor. And agents for the treatment of ulcers and gastroesophageal reflux disease, or GERD. H2 blockers, or histamine blockers. There are histamine receptors in the stomach that are called H2 receptors. H2 blockers reduce gastric acid secretion by acting as histamine 2 blockers. They also reduce the amount of gastric acid released in response to stimuli such as food and caffeine. Drugs included in this category: cimetidine, famotidine, and ranitidine. They all have similar sounding names. They're used for the short-term relief of acid indigestion and heartburn, GERD, esophagitis, and prevention of duodenal ulcer recurrence. Side effects of these medications can include diarrhea, dizziness, rash, headache, mild gynecomastia with cimetidine, mental confusion. They're pretty mild. They don't have a lot of side effects. Famotidine has to be renally dose adjusted. I know that much. Ranitidine we don't use too often in our hospital because it's not on our formulary. So we do want to have caution with renal disease. We may need to adjust the dose or frequency. Pregnancy and lactation are also precautions. As always, keep that in mind before you hand a pregnant woman a medication. Make sure she's able or she's allowed to take it, that it's advisable. Proton pump inhibitors. These are one of the classes of most commonly used drugs. Protonix, omeprazole, or Prilosec. A lot of these are now over the counter and can be just bought by patients whenever they feel they're having an episode of GERD. GERD is caused by the excessive reflux of gastric acid contents into the esophagus. It can result in irritation and injury to the esophageal lining, and also pain and inability to eat. Serious complications include esophageal stricture, pulmonary aspiration, and esophageal cancer. So proton pump inhibitors are similar to histamine blockers in that they block the release of acid. So they're usually used again for short-term treatment. Anybody who's using them for more than 4 to 8 weeks really needs to see a doctor in order to get further treatment. So we talked about the names of the drugs. Side effects can include diarrhea, constipation, nausea, vomiting, and abdominal pain. Increased risk for pneumonia or C. diff infection, which is an infection of the feces. Long-term use on a regular basis can also result in vitamin B12 deficiency and low magnesium levels. It has also been associated with interference with calcium absorption, which can lead to osteoporosis. A lot of side effects, but this is, again, one of the most commonly used drugs. Gastric mucosal agents. These are going to be your protectors of your gastric lining. Misoprostol is a synthetic form of prostaglandin E. Prostaglandins secrete substances that protect the gastric acid or the gastric lining. So misoprostol inhibits gastric acid secretion and protects the mucosa from the irritant effects of certain drugs, for example, NSAIDs. It's combined with NSAIDs to protect the lining because NSAIDs are very irritating to the stomach. Side effects can include diarrhea, nausea, and abdominal pain. You want to avoid giving this to pregnant women because it can also cause contractions of the uterus. And other than that, it's pretty benign except for that spontaneous abortion, so you need to be careful with that. Sucralfate or Carafate is an inhibitor of pepsin, another anti-ulcer agent that acts in a different way. It's administered on an empty stomach, and it reacts with hydrochloric acid in the stomach to form a paste that adheres to the entire stomach lining, thus protecting an ulcer or the lining from irritation. Side effects are rare, however, interactions, because it's creating that paste around the stomach, it can cause drugs to be not absorbed. So usually if we're going to give a medication that needs to be absorbed, it's either given 2 hours before or 2 hours after. Heliobacter pylori treatment. H. pylori is a bacteria that plays a major role in developing ulcers in the stomach, and it's usually treated with multiple drugs, including PPIs, sometimes antibiotics, etc. I don't know why they threw it in here because they don't cover it a lot. It's not seen very often. Just keep in mind when this patient comes in with H. pylori, they're going to be treated usually for 14 days with multiple antibiotics and possibly a proton pump inhibitor. GI antispasmodics or anticholinergics. Again, we want to stop things from moving, so we might use them to calm the bowel. Dicyclomine is most commonly used. It's an anticholinergic and antimuscarinic agent used for irritable bowel syndrome and other functional disturbances of GI motility. Often it'll be used after surgery to get the GI tract moving again. To prevent, not to get the GI tract moving again, I'm thinking of something else. It's to prevent too much irritation, to prevent too much moving through of the contents of the GI tract. So it decreases motility. Side effects of dicyclomine include dry mouth and constipation. Keep in mind it's an anticholinergic, so it's drying everything up. Blurred vision, dizziness and drowsiness, tachycardia, confusion, and urinary retention. We want to be careful because it's an anticholinergic. We want to be careful in our patients with glaucoma, as well as those with unstable cardiac disease. If they had an obstructive GI disease or obstructive uropathy such as BPH, myasthenia gravis, and women who are lactating. Agents for IBS. Inflammatory bowel disease is a chronic condition that causes inflammation in the lining of the GI tract and includes Crohn's disease and ulcerative colitis. One of the main features is abnormal defecation, which can be constipation or diarrhea. Usually it's one or the other. It doesn't really ever both at the same time. There's no cure, so we focus on treating the symptoms and controlling them from getting worse. Salicylates. Salicylates that are used to treat Crohn's disease or ulcerative colitis include mesalamine and the prodrug sulfasalazine, and they are similar to aspirin and exhibit anti-inflammatory activity in the GI tract. I'm going to let you go over the side effects and precautions because I feel like I'm kind of reading out of the book when it comes to that. We're going to focus on different factors about the drugs. Mesalamine and sulfasalazine, so especially mesalamine, can be used either orally or rectally. It might be used rectally if someone was having a ulcerative colitis issue where they had a ulcer at the far end of their GI tract. Glucocorticoids are used to treat inflammation as well in inflammatory bowel disease, and I believe those are covered in chapter 23, so you can refer back to that if you have any questions on glucocorticoids. Antidiarrheal agents work to reduce the number of loose stools that a patient might be experiencing. One you're all very familiar with is bismuth, subsalicylate, which is Pepto-Bismol, that fun pink liquid. Bismuth is an anti-secretory, I don't know if I'm saying that right, today. It has a direct mucosal protective effect and weak antacid and anti-inflammatory effects. Someone might take it if they were having diarrhea, upset stomach, and it kind of creates, again, a protective lining so that the stomach isn't irritated. Side effects include transient occasional constipation, discoloration of the tongue and stools, and ringing in the ears. We want to be careful in children under 12 because it can, or children or teenagers recovering from chickenpox, because it can cause Reye syndrome. Opiate agents, diphenoxylate with atropine and loperamide. These are opiate agonists. They slow intestinal motility, thus allowing for more reabsorption of fluid and less chance of diarrhea. And again, they don't cover too much here. Side effects can include anticholinergic effects with Lomotil, abdominal distension, nausea, and vomiting. Probiotics are microorganisms that are good bacteria for the patient's intestine. If you don't have enough good bacteria, this is often will result in diarrhea or upset stomach. So good bacteria help things move through normally and keep everything on the right track. The body's naturally occurring gut flora may fall out of balance due to antibiotics, stress, alcohol, certain diseases, and exposure to toxic substances. So sometimes you need to take a probiotic to rebalance the gut flora. We talked a little bit about C. diff earlier, which is an infection of the feces. It leads to severe diarrhea, which can cause dehydration and other problems, and it can be difficult to get rid of. Complications may include sepsis, renal failure, toxic colitis, and death. So C. diff is usually due to antibiotics, which cause the eradication of healthy gut flora, and now C. diff has been able to take over. Usually it's treated with metronidazole, which is also called Flagyl, or vancomycin. Chapter 17 has more information on those agents. Antiflatulence, which means anti-gas medications. They are used in the symptomatic treatment of gastric bloating and postoperative gas pains, and they help break up gas bubbles in the GI tract. We're talking mostly simethicone is the biggest example of medication I can think of here. I'm going to pause here and move on to a second video for the rest of the chapter.